Hi, I'm Brianna Steichen from Porter High School. Our HOSA chapter is 6. We decided to do medical intervention over ventricular septal defect. You may be wondering what ventricular septal defect is. Well, ventricular septal defect is when the two lower chambers of the heart, there's an opening between them, the right ventricle and the left ventricle. VSD is when the right ventricle and left ventricle don't develop correctly and end up leaving an opening. This occurs during pregnancy, and the baby is born with it. This cannot develop, and they are fully born with it. With VSD, the blood flows from the left ventricle through the septal defect to the right ventricle into the lungs. This puts extra force onto the heart and lungs, which can then cause further complications. About 1 in 500 babies have VSD. VSD is the most common heart defect.
Hello, my name is Kimberly Rocha, and today I'm going to be talking about the current device that is being used to help with a birth defect. And this device is called the Amplexer. This device can vary in shape and size, and I have 4 different models here that represent the sizes and the shape that can be surgically implanted into the heart. And this device can range up to $11,000 to $21,000, and the success rate is around 93%. Some of the risks or symptoms that can vary with each patient include strokes, transient ischemic attack, also known as TIA, migraines, and/or dyspnea. A surgical procedure that will be required to implant this into the heart is called a surgical median sternotomy, which is a surgical incision that will be done on the front of the body, and it will crack open the sternum and will be an open heart surgery. The training requirements to become a cardiothoracic surgeon will require you to have a high school degree. Then you will need to obtain a 4-year undergraduate degree in pre-med with an emphasis on science. Then you would need to attend and graduate from a 4-year medical school, and then complete a 5-year general surgery residency program, then enter a 2 or 3-year cardiothoracic surgery residency program, and then, or you could either enter a 6-year integrated cardiothoracic surgery residency. A career impact that this has on cardiothoracic surgeons currently is that they are satisfied with the choice of the career and are hopeful to show the next generation what a great specialty it is, since cardiothoracic surgeons are very crucial to society nowadays.
Hello, my name is Delson Sanchez, and as my partner said, we are currently using this emphasizer device to be put in the left and right ventricle where there is an opening. But we decided to use a mental tissue in the left and right ventricle opening. You may be wondering, why the mental tissue? Well, we decided on mental tissue because it regenerates. It has a pretty high role in the immune response and your immune metabolism. This procedure would start off by having a mental biopsy where we get the tissue from. It would be inserting a needle through the skin and getting just a sample of the mental tissue. After that, we will perform an open surgical median sternotomy, which will be open heart surgery, where we will insert the mental tissue on the left and right ventricle. So it would be about a little part of the mental tissue in the left and right ventricle. We believe that our success rate will be 96% success rate based on all our information. Some effects from the tissue transplant will be diarrhea, high blood pressure, high cholesterol, and so on. Some risks from our skin graft can be bleeding, graft failure, poor healing, and so on. Some side effects from a tissue transplant includes short-term medication, side effects such as hair growth, hair loss, acne, and mood swings. The definition of our device would be more easier compared to the amplifier device because the mental tissue is already from the patient's skin tissue, which will allow the body to not reject the skin as it would reject the emphasizer as easily. Compared to the amplifier and our tissue would be only a once-in-a-lifetime surgery. Compared to the emphasizer, would have to get that surgically removed after a while because it would be inoperable and the device wouldn't work as well as it's designed as. Thank you for your time.
Thank you for your time.
Thank you for your time.